Urinary incontinence or leaky bladders is a very common problem among women. Even young girls in their teens experience urinary incontinence, but the incidence certainly increases as women age, increase their activity levels, have babies, or anything that increases intra-abdominal pressure. In our practice, we have lots of options to discuss with you for your treatment of leaky bladders or urinary incontinence. And some of those traditional therapies have included a mesh sling, and that's what this is. And this is a treatment that's used for stress incontinence, which is leaking with coughing, laughing, sneezing. And as you can see, this is a surgical procedure that involves anesthesia. The patient goes to sleep, and then this introducer is used to anchor this into the muscles of the pelvis. And then this sling sits underneath the urethra to support the urethra. This is a very effective treatment for urinary incontinence, with about 90% of women being dry after having a suburethral sling. Unfortunately, it does have some risks associated with this procedure, as well as some downtime. And we ask our patients to refrain from sexual intercourse or heavy lifting for 6 weeks after the procedure. Certainly, Kegel exercises have been used, although the success rate is extremely limited. Seeing a pelvic physical therapist is also an option for urinary incontinence. In addition, many women have a different kind of incontinence called overactive bladder or urinary frequency, or just women who leak because they wait too long. The first line of therapy for that kind of incontinence are medications. These medications can be pricey, as well as cause some side effects such as dry mouth or constipation, or just not give women the relief that they need. Traditional medical therapy after medications fail or have side effects can include Botox injections of the bladder or even InterStim therapy, which is kind of like a pacemaker for the bladder. And these are also great options for the appropriate patients, but certainly they do have their side effects and risks associated with it. The OShot, or the orgasm shot, was initially developed to help with women with sexual dysfunction and help women achieve orgasm better, vaginal dryness resolves, painful sex often resolves. But as providers have been using the OShot for sexual dysfunction, we have seen that it also treats urinary incontinence just wonderfully without the downtime or risks associated with traditional therapy. Using the Intima laser, which is a vaginal CO2 laser, along with the OShot, called the Leo procedure, gives even more dramatic results for the treatment of incontinence. So as you can see, we have a lot of tools in our toolbox here at our practice to offer women treatment for urinary incontinence or leaky bladders. So I'd love to discuss this with you in more detail, either with myself or one of our other providers here at Amy Brenner, MD and Associates.